I think employers really should stop thinking about health coaching as a standalone well-being activity or offering, which kind of is really validating what we're seeing right within our client programs. And they really need to start thinking about coaching as part of an overall workforce health strategy. So really breaking that down is the question is no longer should we offer coaching? The real question is where does individualized support create the greatest strategic value within our population to really drive towards an employer's goals and objectives?
Welcome to Navigate's People's First podcast. Thank you for joining us. Today we're doing something a little bit different, a leadership roundtable focused on one big question. Where is health coaching in 2026 and where is it headed? The well-being space is evolving quickly and organizations are facing growing pressure to cut through vendor noise, to prove results, and create strategies that drive behavior change. In today's conversation, we're digging into the biggest shifts happening in the coaching landscape, as well as where organizations should be investing and how leading employers are trying coaching to deliver measurable business outcomes. To help unpack all of this, I'm joined by a panel of experts from across Navigate who are helping employers rethink what effective coaching looks like in the years ahead. I'm Jeremy Knipper, CTO here at Navigate, and I'll start by introducing Dr. Jennifer Musick, Vice President of Health Solutions, Mikki Walters, our Director of Health Solution Services, and Jenn Lowry, Vice President of Product Strategy. Dr. Jenn, would you mind giving us a quick bit of your background?
Sure. Well, I am proud to be on the call today. Happy to support the conversation around health coaching. As the VP of Clinical Strategy at Navigate, my responsibilities really are around working with clients and our team members to develop clinical well-being strategies for our clients and their members, evolving our clinical well-being solutions, and then also just overseeing clinical rigor, clinical governance, and oversight from a quality perspective.
Glad to have you here today. Mikki, would you give us a little bit of your experience in coaching?
Yeah, wonderful. Thanks, Jeremy. So I've been in the industry for almost 20 years already and working side by side with our client success team, Dr. Jenn on our clinical side, and all of our team members at Navigate to ensure that we're bringing our coaching solutions to our clients and our partners. So on the operations side, I get the benefit of leading our coach team and our coach managers to ensure that we're delivering on the quality and the outcomes that our clients expect.
Excellent. And Jenn, can you share a little bit about your history in the healthcare space?
Absolutely. Thanks for inviting me today. So, I've been in the well-being industry for over 20 years, which is so hard to believe, and so much has changed in that 20 years. But I have the privilege of working alongside a product team that conceptualizes and then works with the technology team to develop solutions to support our clients in achieving their well-being goals, but also participants to live their healthiest and happiest lives. And prior to Navigate, I worked in the on-site healthcare space, which we delivered health coaching at that time as well.
Well, we've got the brain trust of most of our products and especially our health coaching solutions here at Navigate. So I'm really looking forward to today's conversation. Dr. Jenn, can we start with you? To me, the big question is this: is health coaching in the market heating up, cooling down, staying the same? What are you seeing out there?
Yeah, I actually would say the market isn't cooling down, it's maturing. I think that well-being and coaching, the coaching market in particular, is really undergoing a very important transition right now. Historically, I think health coaching was really often positioned broadly, general like health coaching, wellness coaching, lifestyle coaching. But I think employers are smarter about the investments that they're making, and they're tying health coaching investments to their cost and risks. So I think the future of health coaching is much more targeted and integrated. Employers really are connecting coaching to their cost and their risks. So investments in things like cardiometabolic risk reduction, obesity management, diabetes management and prevention, mental well-being, GLP-1 strategies, and real measurable risk reduction. So, in other words, I would say coaching is really moving closer to a risk management strategy. So, it really has evolved and matured over the years.
Interesting. Jenn, you've been running our product team for a while. You have a lot of background on what's being asked of us from an employer standpoint, from a broker standpoint. You're seeing competing products out there. What's your take? Heating up, cooling down, or somewhere in between?
probably in between. And I would agree with Jen that it's really evolved over time. I think if we look back and rewind the clock a little bit, I think health coaching was offered to address immediate needs and the immediate costs or risks that exist today. Now, with all of the data that's available, especially around predictive modeling, employers are really looking to solutions to solve for potential risks in the future and dollars that may not be being spent today, but could be spent in the future. So that's where I think it's kind of in between because you still have to solve for those immediate risks and those that are um, really causing those high costs within the claims, but also how can we prevent individuals from passing that threshold of the risk and moving into a condition risk.
Interesting. Mikki, you work probably closest with our clients and especially with our coaching team. How have expectations changed? And, as Dr. Jenn said, this is sort of a maturation of the product. How have expectations changed for clients and participants who are involved in the programs and our coaches too, I guess?
Yeah, thanks, Jeremy. So I do really get to enjoy working with our clients and sitting down with them on a regular basis to kind of share what's happening on the coaching side. And what we're seeing really is that evolution take place where health coaching was kind of a nice to have, provide a person that can have a great relationship on a personal level, someone you can trust to really get into your health information. And now we're really pivoting to how do we actually help again reduce those risk factors and make that more meaningful for the individual? Not just a relationship, that's at the baseline, but really helping them move that needle, educating them and really getting them to take action, to address those like higher costly conditions that they do have. So we see that at program design and we see that at the member level. Our clients are adding more of our clinical focus programs and really tying their program designs to biometrics, claims information, like Jen Lowry had mentioned, to kind of look at what the future risks are bringing so that our health coaches then can use all of the information that they have to support that member along their wellness journey.
I'd love to dovetail on something Mikki just said. Coaching as a, no longer a nice to have, but a need to have. I actually think that that's a really key point. When we talk about the market maturing or cooling down.
That's a great point, and I want to have you expand on that a little bit after I posit this. In the marketplace, there's been a significant expansion of focus on return on those investments, right? We've seen medical spends are always going up, right? That's, whether it be 1% or 3%, it's never 1%, 2 or 3%. Lately we've been seeing close to double digit increases that some of our employer populations are seeing in their medical premiums. Um, ROI is a great concept to make sure that we're doing the right thing with our spends. But I posit that ROI doesn't come without engagement. And to me, one of the best tools you can have to engage a population is a coaching program, but it's also making sure that you're doing all of those things that drive engagement. The culture building activities, the investment by your leadership team, having good, strong communications. Can you talk a little bit about how coaching can help, not just the ROI story, but how it can drive engagement and drive culture of the organization?
Sure. I just was having this conversation last week with a colleague. And to me, I was at a conference and there were almost like the grumblings of like, oh, investing in culture isn't really that important anymore. And we're seeing kind of this shift towards risk management because of the rising cost of healthcare. I actually took a step back and said, it's not culture or risk management, right? Or point solutions or coaching. It's and. As an employer, you can try to, implement risk management strategies like health coaching and point solutions. But if the culture isn't being taken care of, you won't drive the engagement that you need to generate that impact, right? So those point solutions and risk management strategies, including programs like health coaching, need to be layered into a healthy workforce culture, a workplace culture. The culture has to be in place and intact in order for employees to trust those individual support programs you're bringing forward and those benefits, in order to trust those programs and engage in them so that we can actually work with individuals to yield that impact. So I'm totally with you, Jeremy. It's like it's not culture or, risk management, it's culture and risk management to really generate health improvement, which gets you to ROI. So that's exactly a great point. And I happen to believe that health coaching programs, and not just I, but the data supports that, right? Is like it's a really great tool for those members that are higher risk, higher need, and often maybe less willing to change right out of the gate, right? So it's a really great vehicle to engage those members that are harder to reach within your employee population, and really build a relationship, and really drive towards that meaningful health and well-being improvement that we're all looking for.
And I'll just add to that. I think about, you ask about engagement and how health coaching can impact that. I think about that relationship, Mickey, that you were talking about, that they are building that relationship with their health coach. They are an advocate for that participant. And it's not just about improving their physical fitness or their nutrition habits. They are talking to individuals about social well being, purpose, even their experience in the workplace, which again, that ties back to the workplace culture. So they're really pointing them to the right resources, making sure that they're establishing healthy habits really across all of those aspects of well being, not just as it relates to physical health or nutrition.
Mikki, how are some of the ways that our coaches are helping to build that trust?
Yeah. So, I mean, at the core, right, health coaching is really about building that trust and educating the member and helping them remove those barriers that we were just talking about that yield high engagement across the resources that they need the most. And so, from the beginning, right, the coach gets to know you on a personal level, opens that door to learn about you, learn about things that you've maybe struggled with historically or successes that you've had, and really kind of feed off of that information to help you along your journey or along your path. Our coaches are dedicated to our members, so you're seeing the same coach every single time that you're engaging. It's not a call center of coaches that you're just kind of taking your call at the time. You know who your coach is, when they're contacting you, and how to even engage with them between the coaching sessions so that member knows that they always have a resource, a kind of a team member, right, on their side that can help them get to where they need to be.
I want to switch it up a little bit and I want to talk about planning and prioritization for our partners in HR. So, Jen Lowry, if you're an HR benefits leader, your open enrollment's right around the corner, you're planning for 2027, what are the kind of things you should be thinking about?
So first I would be thinking of, I think what we just talked about, culture, right? Where is my culture at? And are they ready to make a change as far as adding new services to support their overall well-being? Then I'd be looking at data. Where are the areas of that I need to be focusing on as it relates to medical and pharmacy claims? And then also, where is my overall participation in my well-being program? And there you can really start to see insights from maybe your HRA, or for us, that total health survey or well-being survey, to really start to direct the decisions of what type of coaching is really needed for my population.
I actually also, again, last week having this conversation at a conference of, state and local government, but I actually think employers need to remember it doesn't have to be hard, right? So we don't need to overcomplicate your workforce health strategies. I think we're living currently in an environment where we've got, our ecosystems are very complicated and complex because we're trying to again, we're using data like Jen's mentioning, using data to try to tackle areas of risk and cost for our business, which has actually kind of spiraled into lots of vendors and lots of disconnected point solutions and lots of apps for members to engage in. And as an HR leader, you have to remember complexity itself becomes a barrier to engagement. Some of the strongest outcomes that we've seen within our book of business at Navigate come from relatively simple but highly aligned strategies: the right incentives, the right outreach, the right coaching pathways, and the right integration between culture, care, and clinical support, right? The Navigate way. The example I always think of is Lynn County, right? Lisa has used this model and generated the outcomes and impact from a health and financial perspective that employers are seeking. So, as an HR leader, my recommendation is it doesn't have to be complicated, but it does absolutely have to go beyond a digital platform, and it does need to layer on top of a healthy workplace culture.
Dr. Jen, you make a really good point about vendors and the ecosystems out there. And I've been hearing the concept of vendor fatigue vendor overload, however you want to call it, for a long time now. And for me, that's hand in hand with a conversation about return on investment. Is not just, are your platforms performing, are your vendors performing, but how many of them you have and how many of them can actually impact parts of your population. Um, Mikki, I know we've got a client that's got a really interesting story around sort of the concept of vendor fatigue. They're a large scale food product in the large scale food production space, and that if you've had chicken in this country, you've probably consumed their product. Um, can you tell us a little bit about our friends in the farming space?
Yeah, for sure. This was a really fun client to collaborate with because, again, they have their culture at heart. They're really doing the best things that they can for the people that are serving, their farming needs. And so, working with them, what we realized is that, again, there was that vendor fatigue and just that disconnect. So, members didn't really know where to go. We have that solution at Navigate where we have the one stop shop, but the members to engage still had to do an extra step. They were confused about who their kind of trusted partner was when it came to health coaching programs or other things. And the client was also frustrated with just lack of data transparency and feedback from those programs and those solutions. And so we were actually able to help them migrate from a different partner into our coaching programs. They actually took our condition management program because they wanted to see more than just a single condition being addressed, like we do see with other like point solutions. They wanted more of a holistic coaching approach that could address multiple conditions. And then they really did want to see that support with moving those individuals and transitioning them. And so we were able to come in with that partner, transition those members that were actively working with that partner into our Navigate coaching programs. And we've already had our first kind of quarterly review with that team. And they were really excited, even about just the engagement that we were seeing and the data transparency and feedback that we were giving them from their members and from just the design and how we had set that up from the beginning.
I know we're really proud of the work we've done, especially with that client. You know, I don't think I'm talking out of class when I say that they had a challenging experience when it came to well-being. They had bounced from several vendors who weren't able to meet their needs. I think it was 3 years or something close to that before they landed with us. And just super proud of the work we've done with them and the results that they're seeing. And
And one more, Jeremy, if you don't mind, even kind of on that opposite side. So this group that we were talking about again had kind of a rotating door of partners, right? They had kind of the three over 3 years before they came to Navigate with those solutions. Another one, though, we've been working with for a number of years and have had very high engagement, a very strong culture. And even with rolling out kind of our design and our model and some of our new coaching solutions that, again, meet the member where they are a lot more holistic than some of the point solutions that we see in the market. We had over 400 individuals with that client in the first 60 days reach out and start engaging in coaching. That's a pretty big percentage for their population. And I think it was back to that engagement again. They trusted the culture, kind of heard the needs from those members, and they had easy access to get into those kind of coaching solutions right on platform.
Mickey, that's a manufacturing client, right?
That is a manufacturing client as well. Yeah.
Yeah, so for our HR folks out there, right, that are like, "Oh, we're in manufacturing and coaching definitely doesn't work." I think our experience over the last 20 plus years has been very different, right? That individual supports almost a better way to engage that kind of a workforce. Yeah.
that's one of the things I'm most proud of at Navigate. Every year, Jen's team comes up with the annual aggregate book of business details, and we break that down by clients and by industry. And manufacturing has been at the top of our list, especially last year, which is everybody thinks that's a really challenging segment, and it is, but only if your solution is one size fits all, only if you're not listening to their needs and understanding their culture and how they communicate, how they do business. And we follow up by manufacturing, by healthcare, which is another really challenging population, geographically diverse, spread out at different locations, working odd shifts. I mean, I'm proud of the fact that we do our best work when it's the hardest thing we're trying to do with the hardest populations to reach. That's just me bragging for a couple minutes. Um, so if you're out there and you've got vendor fatigue, Jen Lowry, what should an organization do to evaluate whether their point solution is adding value, or like Dr. Jen said, just adding complexity and noise?
Yeah, I think the first thing is understand your data. What data is available to you? What data is not available to you? I think is another key factor that really people don't identify enough, right? Sometimes we just take what is available to us as is and we just move forward. But are you asking yourself the right question of do you have the data needed to really be strategic in your program and also move the needle in your health outcomes or just the goals that you want to achieve? I think then it's really about where are you identifying overlap of those surfaces? And I think, Dr. Jen, you've done a really great job within client conversations and just on our organization of talking about how our health coaching sometimes isn't about replacing, but it's about augmenting one of those point solutions.
Yeah, I just had that conversation this morning on a client call, Jen, and I would always say is, at Navigate, we're going to come into that coaching conversation and say, is this an and situation, right? Is there something you have in place that we could actually augment or enhance? Or is it an or, right? Is that current solution not meeting your intended objective, your needs, and is our solution a better fit? And there's no, right? There's no same answer every single time, right? It requires that data analysis and evaluation, Jen, that you're talking about. Yeah.
I know we're talking a lot about health coaching today, but I think it would be only fair for us to say that we're not trying to tell people to switch out their vendors. That there's plenty of really good vendors out there that are doing really good work, and our platform and our program design and our strategy that we work with you on is built around incorporating tools that are working. And I think what we're talking about here is just looking at the ones that aren't working and aren't getting engagement, and are they still the best solution? Which leads me to a conversation about the business case for health coaching, right? We've talked a little bit about this. And a lot of it feels like it's an either or with some of these individual platforms. Um, Dr. Jen, can you talk a little bit about the case for a point solution that addresses one thing exclusively, and compare that to the case of a broad, robust, holistic solution suite of coaching opportunities?
Yeah, certainly. Again, I think you've heard this a number of times, especially from Jen, but it's like that you have to use your data. I think for employers, in that business case, the first thing you have to identify is what does success look like? What are you trying to accomplish, right? What is that goal? What is that objective? What data do you have available or do you not have available, right? That helps you evaluate whether your current strategies and initiatives are moving towards those goals and those objectives. And then you can really decide, right? If it is making progress and you are meeting the intended objectives, then it's stay the course and continue to evaluate, and actually start to evaluate the next opportunity. If they're not, if your current strategies and initiatives aren't moving you towards your goals, that's really where you can start to dig in and understand why not, right? Do we have an engagement issue? Do we need to focus more on engagement strategies? Or do we just have a solution that isn't meeting the needs of our members? I'd say one of the strongest business cases for a more comprehensive, holistic, or integrated approach is, um, you know, having a bunch of apps for members to engage in, kind of back to the simplicity story, is the more different partners we bring into our health and well-being strategy, we're asking our members to engage different platforms, different apps. Many of those point solutions are, digital first solutions, which is great for some members, but often leaves members then, navigating multiple different platforms and apps. So, that may generate the need, and the business case for kind of looking at a different approach, an approach that's more comprehensive. The employer that Mikki was talking about, they were really lacking data, right? So that was the number one reason for them to ask more questions and evaluate our coaching offering, is they weren't even getting engagement, let alone impact data, or utilization data was missing as well. And then we also take a very comprehensive approach when we in all of our coaching programs, especially in our condition management coaching program, we're supporting members at highest risk, highest need across their chronic their all of their chronic diseases. We're not just focused on a single condition. So that made it more appealing for this employer. And it starts with his goals, right? I mean, he understood that his goal, it was measurable health improvement in the areas of diabetes and heart disease. So knowing that our condition management coaching program takes a holistic approach at working with those individual members and engaging their personal physicians, that was more appealing to him. Our solution in that case actually moved him closer to his program goals and objectives. And that's really the business case then, right? Is like, are you trying to augment what you're currently offering? And then how do you find the financing mechanism to do that? Or if it's not meeting your objectives, right, it creates like a repurposing of those budget dollars so that you can, work with an initiative or in a strategy that really helps you work towards those goals or objectives. Hoping I answered that as clearly as I could, Jeremy. I know that's a probably a podcast. That's probably a podcast on its own, right? Is making the business case for coaching. But I'm going to take that all the way back to the beginning, right? Which is like, we really should be not thinking about coaching as a separate wellness activity, right? Or a separate initiative. When you're talking about your well-being, your health and well-being strategies, you should it really is where does individual support have the opportunity to drive impact towards our goals, right? That's how we should be thinking about health coaching as part of our overall health and well-being approach.
Yeah, Jen, if I can just add to that, as you were talking through that, I kept thinking about health coaching is health coaching with Navigate is not the same as health coaching at an EAP or health coaching through another vendor. It is really important to evaluate health coaching as the model and what methodologies are used. What do those sessions look like, and what are the outcomes of that coaching that's being offered? So again, it's really hard in the market because you see all of these point solutions offering coaching, but some of those point solutions are really satisfied with, I think we heard recently, a 1% engagement rate. How is that actually driving outcomes, right? And so that's why it's really important to look at the model. And again, look at that as you're building that business case, understanding where you want to go, not just this year, in the 5 years, and then finding a solution or a coaching solution that aligns with that.
For sure. Peel back the layers of the onion for sure. Yeah. Yeah. Jeremy, real quick on the business case front, I think this actually brings us to a topic that we shouldn't, I think about immediately, which is, right now, GLP-1, like cost urgent is creating urgency, right? So GLP-1 costs for obesity care, obesity management is creating urgency within the employer community, right? So right there, right, that's an opportunity to create a business case. I happen to believe that the GLP-1s for obesity management have really accelerated the importance of health coaching. Employers realize that obesity management can't just be solved through medication access alone, and long-term success does depend on bringing in behavior change, nutrition support, emotional well-being, accountability, all leading towards sustainable behavior change. So that really means that coaching is part of that operational strategy around GLP-1 cost management. So again, back to business case, Jeremy, right? Is like, if that's an issue that you're dealing with, I know right now I've been talking to brokers that are like, employers are thinking about walking back their GLP-1 benefit, right, around obesity care and management. And others that don't want to go that route, right? How do we do things differently so we can better manage those costs? So again, all about the business case. So back to Jen's point too, understand your goals, understand what you're trying to achieve, and then really dig into those partners to make sure that you understand what the model looks like and if it can actually help you accomplish your goals.
We're seeing that with our real clients today already, right? So the partners that have started to use us and our weight management programs to support the mitigating the risk around the cost of GLP-1s, and even ensuring that the people that are accessing the GLP-1 have that resource for behavior change and not just medication. We've had a group already that is starting to report that individuals are already reducing or not even going on a GLP-1 because they're seeing the success in just a weight management coaching program, which the data shows is going to last for like sustainable long-term health improvements and not just kind of that quick fix. So pairing those together, we're seeing that with a few clients and a lot more attraction from the current clients of how do I now get smarter with my business case to make room for that? We had one other client that they had our condition management program. They had some great success over the last few years. We're actually reducing their budget for condition management because people are healthier. What that did for that client is opened up about $10,000 for them to use on weight management now because they weren't tackling everything at once, but saying, now I've got some savings here. We reduced the risk of my population. GLP-1 is still a craze. Let's plug in weight management now and start to get ahead of this one as well. So again, business case of you don't have to do health coaching all over. Tackle one thing at a time, and we can help you do that with a number of different solutions to kind of plug and play when it's appropriate.
Mikki, you talk about our GLP-1 work and our weight management program. We've got coaching solutions around a wide variety of topics that address a wide variety of needs: GLP-1 support, weight management, mental health, career development, women's health coaching. What are you hearing from our clients around all of those different offerings that can help them out?
Excitement, really. I think it's a ton of excitement knowing again that they can partner with Navigate and get those needs all in one place with the same care team, the same trusted coach team that we have in place at Navigate today. Mental health is a big one. Over the last year, we've actually plugged in mental health coaching sessions to a number of our programs because we know that at the core, your mental health really does impact how you are managing your diabetes or your professional development or other areas of your life that can impact you as a whole person. And so clients are excited, not that we just have kind of specialized programs, but within our specialized programs, you have multiple components, multiple care team members with those different specialties that they feel like they're bringing something to the table to, again, address the whole person.
I was just thinking, I'm like, that's something Jen mentioned earlier, right? And navigate coaching is different because it's whole person, or maybe it was you, Jeremy, but Mikki just described that, right? That whole person support, even within a navigate coaching program. Yeah.
Yeah, why is Navigate pursuing such a diverse coaching set, Jen Lowry? And career development traditionally hasn't been rolled into the well-being space. Mental health has been adjacent to the well-being space, and women's health is has gotten a lot of run lately, but traditionally it has been very much sort of a swept under the rug topic. Can you talk a little bit about our strategy around developing these broader solution sets?
Sure. I mean, it really comes down to what I mentioned earlier is well-being isn't just thought of as the physical health and in the nutrition side of things, right? It really is about the whole person. It's not just the whole person, who we are in our personal life, but how we show up to work. And that's one of the reasons we developed our professional development coaching, which we launched in January. It's tied back to our Navigate You assessment, which is a personality assessment. So that assessment gives somebody the results of what their archetypes are and what their strengths. That coaching helps them better understand that result, right? About what that archetype means when it says that I'm a coach and I am less on the humorous side and I'm less on the creative side, right? That doesn't actually mean that. So that coaching brings that person through that process of better understanding who they are, how they show up to work, how they show up in conversations, and then help them apply their learnings to the real world.
We're running out of time, and I want to make sure we get a chance to talk about all the good work we're doing in the state of Nebraska. Won't get into too many specifics about it, but we've got plenty of large clients in Nebraska who are doing good work, and that we're doing good work for them and in interesting ways. One of them is a GLP-1 companion program. Mikki, would you be willing to talk a little bit about what we're doing with that health system?
Yeah, for sure. So this is a health system who had an internal kind of program around GLP-1s, and they came to Navigate and said, we need some help here. We really want to see what we can do to offer, again, that behavioral side of weight management before granting access or coverage for a GLP-1 on our insurance because they were really seeing those costs increase exponentially. So they partnered with us. That design worked really well, where a member would actually have a prescription from their provider for that GLP-1, but before actually having that covered on their health plan, they would complete the majority of our weight management program. And what we saw there, and we've got some early results coming again, is that those individuals, some of those individuals didn't even fill their prescription. They were having great success, with their weight loss, working with their health coach team. They didn't even go that route. or if individuals were maybe already on that medication, then they were starting to phase off because they were seeing again that success, and the coaches were able to help them through that transition again for long-term success that way. We're also seeing that pick up with a number of client requests. So
If I recall, that's 29% of members reported reducing or never using GLP-1s because of the coaching program. That we're talking about the value of coaching and the story around how to how to justify the spend on that. 29% of members reducing their utilization or not going down that route is there's a very solid dollar value associated with that, depending on what your spend is. Um, we also do work with a different Nebraska organization that is sort of at the other end of coaching. Would you talk a little bit about that as well?
yeah, this was exciting really to work with this group because they've had well-being programs and solutions in place for a long time, but very piecemealed, I would say. They weren't really connecting them all into like what they were trying to accomplish for their overall objectives. So they were doing biometric health screenings. They had a number of resources available to their members, but they weren't even using that health screening data to inform the program and the platform to personalize the journey for the member. So first step was you're investing already in these screenings. Individuals are taking action to go find out their results. Move that information into the platform so that we can help paint that picture and direct that person to the next best action. In addition, this group thought that their members, they're in healthcare. They know their numbers. They're educated about what they, need to know about their blood pressures and their cholesterol values. But we added a well-being results review to give those individuals access to actually talk to a coach, maybe educate them again about gaps that they would have in their risks, and also point them to that next step. They're busy, right? They're taking care of our people, and so helping them guide them to here's the one next thing that you can do to help benefit you as an individual really hit home for this group. And again, it was kind of a jump in kind of bringing all of their solutions together in a more strategic way. And we're coming out the gate here this year. And I think we already had almost 30% of their population sign up for a well-being results review. And they were, I mean, pleasantly surprised with that. It was something that they're like, really? They really need to meet with a health coach? We're in healthcare. And it's like, yes, everybody needs a health coach in one way or another to kind of help you move along that journey.
I think that that story just kind of highlights that, really the future of workforce health and well-being isn't just awareness, right? It really is converting awareness into action, which generates measurable health, well-being, and risk movement. And that's where clinical coaching, right? And navigate coaching fits strategically. So it's the navigate way, right? We know that we believe at Navigate that the most effective well-being moves participants from awareness into meaningful action that generates impact. And so we're really proud to be leading the charge around culture, care, and clinical here at Navigate, with health coaching really being the human layer, that intervention layer that really is the final missing link for most employer well-being programs. So to Mickey's point, lots of awareness, right, going on within this workforce until they connected culture, care, and clinical now, right? They're really moving the needle and moving that program forward.
I think that is a great place to wrap up the podcast. A great exclamation point at the end of our thought. But we always end the pod with a section that we like to call Best Day Ever, which, if you're paying attention to what we're wearing, I don't think we have any vests on. Uh, but our founder and CEO, Troy, is a fan of vests and has been for a long time. And we want to make sure we do right by him. So, Jen Lowry, give us your best day ever.
Best day ever, but best day ever is how I'm gonna have to say it. It's actually coming up is what I feel like. So on Friday will be my son's last day of middle school. And so I feel like he has survived middle school, but also myself and my husband can also celebrate survival of the first child going through 3 years of middle school. It has been a challenge, uphill battle sometimes, but we did it.
Congratulations on last day of middle school coming up. Dr. Jen, best day ever.
Oh man, well mine is also coming up this week, and my middle daughter Bella graduates from the University of Iowa with her economics degree. She's graduating with honors, and we are so extremely proud of her and looking forward to celebrating her this weekend.
Congratulations as well. Mikki?
Okay, I'm gonna go backwards, not forward here yet. I don't know what it's gonna be yet, but, I'm surprised Jen Lowry didn't say this one. I'd say best day ever. I've got 3 littles, and, it was seeing them light up for their first time ever Disney experience was pretty awesome, so I'm gonna use that one.
I think we've got a lot of fans of Disney on
I
the
understand that.
It made the anti-Disney Mickey a big Disney fan, so
Yeah.
Your heart just melts a little bit when you see their reactions.
heart melts and your wallet melts.
That both at the same time.
For me, it is graduation parties. I don't go to a lot of them. My wife does as a teacher, but I was able to go one last weekend and see some family, and it was just heartwarming and delightful, and had a great time, and grateful to be included in something like that. And it sounds like it's a theme for this time of year as well. Uh, so I think that's where we'll end it. Our podcast today was all about coaching. And at a fundamental level, coaching is about human interaction. The people on the podcast here that are talking to you today are people that I trust and I reach out to when I'm in need, and I can be vulnerable around them. And I hope you have these kind of people in your life, and I hope you get to be that kind of person to someone. I'm Jeremy Knipper on behalf of your regular host, Troy, Dr. Jenn, Mikki, and Jenn, and the rest of the people here at Navigate who go to work for you. I want to say thank you and keep on doing good things.